Why is bone tuberculosis hard to treat? Bone tuberculosis is a challenging condition to manage, and understanding why can help shed light on its complexities. Bone tuberculosis is an extrapulmonary form of tuberculosis, where the bacteria Mycobacterium tuberculosis infects the bone tissue. This infection often develops slowly and can lead to complicated disease progression. One of the main reasons bone tuberculosis is hard to treat is the need for prolonged antibiotic therapy. Treatment typically lasts between 12 to 18 months, sometimes even longer. This duration is necessary because the bacteria can hide in bone tissues that have poor blood supply. When blood flow is limited, it becomes difficult for antibiotics to reach effective levels at the infection site. Additionally, the presence of sclerotic bone, which is hardened and dense, can act as a barrier, further limiting how well the drugs can penetrate the infected areas. The standard anti-tuberculosis medications, such as isoniazid, rifampicin, pyrazinamide, and ethambutol, face challenges in how they are processed in the body. When taken orally, these drugs undergo significant metabolism in the liver, which reduces their availability in the bloodstream and at the bone infection site. To counter this, higher doses may be needed, but this can increase the risk of side effects like liver damage and neurological issues. Such side effects can make it hard for patients to stick to the lengthy treatment plan. Patient compliance is another significant concern. The long duration of treatment, combined with the potential for side effects, often leads to incomplete adherence. This can result in treatment failure and the emergence of drug-resistant strains of Mycobacterium tuberculosis. Multi-drug-resistant and extensively drug-resistant strains are particularly difficult to treat, as they requiring second-line drugs that are less effective and more toxic, leading to even longer treatment courses. Moreover, the bacteria in bone tuberculosis can exist in different metabolic states, including forms that are resistant to standard therapy. Some of these mycobacteria may be dormant or slow-growing within the bone, making them less susceptible to antibiotics that are effective against actively dividing bacteria. In some cases, surgical intervention may be necessary to remove infected bone tissue, correct deformities, or relieving neurological complications caused by the disease. However, surgery is not suitable for all patients and is usually reserved for more advanced or complicated cases. In summary, bone tuberculosis is hard to treat due to the difficulty in delivering effective drug concentrations to the infected bone, the long treatment duration, and associated side effects that can lead to poor compliance, the presence of drug-resistant bacterial populations, and the complex nature of the infection involving sclerotic bone and dormant bacteria. These challenges requiring careful management with extended multi-drug therapy, monitoring for side effects, and sometimes surgical intervention to achieve successful outcomes. Always consult healthcare professionals for personalized medical advice and treatment options.